Receptors of the autonomic nervous system: nicotinic, muscarinic, and adrenergic, by Chrissy Wilhelm. The autonomic nervous system, or the ANS, is responsible for involuntary functions such as heart rate, digestion, and respiration. It is divided into two branches: the sympathetic nervous system, which prepares the body for fight or flight, and the parasympathetic nervous system, which promotes rest and digestion functions. The ANS relies on specific receptors to mediate responses, with nicotinic and muscarinic receptors being cholinergic, or responding to acetylcholine, and adrenergic receptors responding to norepinephrine and epinephrine. The nicotinic receptors are cholinergic receptors that respond to acetylcholine, or ACH, and are primarily found in the autonomic ganglia of both the sympathetic and parasympathetic nervous system, as well as in neuromuscular junctions. They are excitatory, meaning they stimulate postgangliotic neurons or cause muscle contractions. When nicotine binds to these receptors, it can increase heart rate and blood pressure. Drugs like the neuromuscular blockers can inhibit nicotinic receptors, causing paralysis. Muscarinic receptors are another type of cholinergic receptors, but unlike nicotinic receptors, they are found on target organs of the parasympathetic nervous system rather than at the synapses. They have different subtypes, M1 through M5, each with specific functions. M1 receptors are involved in cognitive function, M2 receptors slow heart rate, and M3 receptors stimulate smooth muscle contraction, such as in digestion. Certain drugs, such as atropine, can block muscarinic receptors to increase heart rate in emergency medical situations. Adrenergic receptors respond to norepinephrine and epinephrine and are primarily involved in the sympathetic nervous system activation. There are two main types. There's alpha receptors and beta receptors. The alpha-1 receptors cause vasoconstriction and pupil dilation, while alpha-2 receptors provide negative feedback, decreasing norepinephrine release. Beta-1 receptors increase heart rate and forced contraction, while beta-2 receptors relax smooth muscle, causing bronchodilation, which is useful in asthma treatments. Medications targeting these receptors include beta blockers, which lower heart rate, and beta agonists, which are used to treat asthma. Understanding these receptors has important clinical application in medicine. Nicotinic receptors are targeted by nicotine and neuromuscular blocking drugs used in surgery. Muscarinic receptors are affected by atropine, which increases heart rate, and muscarinic agonists, which help in bladder control. Adrenergic receptor drugs include beta agonists like albuterol, used for asthma, and alpha-beta blockers like prazosin, used for high blood pressure. These medications demonstrate how manipulating autonomic receptors can treat various conditions. Here are a list of some of the common autonomic nervous system drugs. There's epinephrine, propranolol, atropine, pilocarpine, albuterol, and clonidine. And these all work in different ways to help reduce blood pressure or increase bronchodilation. This slide recaps the key points. The nicotinic receptors excite neurons and muscles. Muscarinic receptors regulate parasympathetic functions, and adrenergic receptors drive sympathetic responses. Each receptor type has a distinct physiological role, and understanding them helps in medicine and pharmacology. Each slide emphasizes how drugs interact with these receptors to treat cardiovascular, respiratory, and neurological disorders. For further information, here are 2 resources that I used. Thank you for watching.